And one of the one of the things that we're really concerned about the bill is the dual challenge. So you've got Nicholson, who's the chief executive of the NHS, what they call it the Nicholson Challenge, which is taking out 20 billion out of the health service between 2014 and 15, and at the same time trying to reform the whole NHS, making it a really impossible challenge, because you're reorganising everything at the same time you want to take out 20 billion. And we see that really affecting patient care and all those things. One of the other big issues is the private cap. And you may know that the foundation trusts are allowed, well, they weren't going to be allowed to put a cap up to 90%. They couldn't have more than that, private patients. But at the moment, the new government's thing is 49% cap. So it's possible that Guys and Thomases say could have half their patients could be private patients. That means that people on the NHS scheme will be maybe put to the back of the queue, possibly missing out on care altogether, because money will drive them, because we're in a real financial crisis in the health service. So that's some of really one of the major concerns, because we see that really affecting patient care and ultimately will affect the total workforce. One of the other issues is about competition. Now, we're not generally against competition, but there's competition that will be at the detriment of patient care, because we're seeing companies now taking over, independent sector people taking over aspects of care, and they'll do it for the cheapest cost. And we see any provider can do that, provided they can give some guarantees. So we have no guarantees yet from the commissioning as to how much engagement there will be with all of that. One of the other things that the Royal College of Nurses is really concerned about is the engagement of clinicians. And we want to see clinicians, all types of clinicians, physios, nurses, doctors, engaged at every level. But what we're seeing at the moment in the CCGs, the clinical commissioning groups, is people being appointed sort of lip service to them, appointing people who don't have the skills to be able to challenge, who don't have the competency of the commissioning and that. So we're very concerned about that. We continue to be concerned, and we continue pressing the government on those aspects of what's there. And we're hoping, still hoping, the bill is going through Parliament, in the House of Lords again today, and supposedly to go back to the House of Commons next week. It could still be thrown out. I don't know how much that will be. In that bill, there is no mention of the workforce, which is about the education and training. We see huge changes in that. In London, we're seeing dramatic change across from, the deanery for medical student works across London. They've been fragmented, some nursing things, some physio things. That's all been re-tendered. The education programmes in London have been re-tendered this year, and from next year there'll be some different providers of both nursing education and physio education in the capital. And as yet, people may have been offered a place for September in one university. They'll get their place, but it might not be in the university of their choice. As yet, we don't know what's really happening with the bursaries, and there have been bursaries for student nurse training for people who did diploma level, and now all nursing education is at a degree level. So we don't know what that means to the bursaries yet. The government hasn't quite come clean about what that will mean for students. So we may see a different type of people joining nursing, might lose our diversity that's there. And we may also, we're also very concerned because there is a reduction in the number of places for adult student nurses in London next year, and quite a significant reduction, a reduction of around 20% in that. So, we all see, I don't think there's one area that you would say in nursing that's got enough nurses to be there and care for patients. And that's what we're really about, is making sure that we can get the best deals for patients through education and through the bills. So we're looking at the development of the workforce, and we want to be there at every opportunity of that. And I would just encourage people to, let their MPs know, let people know of what's happening, so that they will feel, empowered, and at least their MPs will know what the issues are, because many of them don't. Okay, thank you very much.